Oral cancer, also known as mouth cancer. It is a type of head and neck cancer that is seen in the oral cavity. Usually, it's a primary lesion. By means of primary lesion, usually originates in the mouth. Sometimes cancer originates from other parts of the body and metastasizes in the mouth. So most of the time that as an oral maxillofacial surgeons, sometimes we determine that oral cancer is a primary lesion in which it originates in the oral cavity. In the initial stage of oral cancer, sometimes it is left unnoticed. So, undetectable. It is undetectable. So, it's impossible for us, okay, to determine whether it is a tissue or your gums or the tissue of your tongue has oral cancer or not. Now, we see oral cancer in its initial stage as red and white lesions. Okay? Or combination of red and white lesions that is painless. Most of the time, it's painless. And we see it in the tongue, floor of the mouth, your gums, your cheeks, your palate, even the oral pharyngeal area. So, one of the things that we check is that we always ask our patient, is the red and white lesions has been there for more than 2 weeks? If so, we do also other examinations like head and neck examinations. For example, is palpation of the lymph nodes of the neck. Because if there is lymphadenitis or even lymphadenopathy, that means the oral cancer is already spreading, okay, to other parts of your body. So the one thing that we do when the oral cancer or the red and white lesions are seen in the oral cavity, is more than 2 weeks, we perform biopsy. Okay. So that we can determine if that tissue that we got, incision or excision biopsy, is cancerous or not. Now, what is the etiology or origin of oral cancer? Oral cancer originates or starts or its source is alcoholism, okay, smoking, betel nut chewing, and nowadays 90% of oral cancers is being caused by a virus. What is this type of virus? It's the human papilloma virus 16 or 18. We can get it through sexual transmission. So 90% of the oral cancers that we deal with are squamous cell carcinoma. It's an aggressive type of oral cancer that can easily metastasize throughout the whole body if it's left unchecked. But one problem with oral cancer, if we can see an obvious signs and symptoms, let's say red and white lesions, usually we find the oral cancer in its advanced stage already. So it's already spread. So it's impossible. It's easy for us to do surgery. It's easy for us to resect the mandible or even the maxilla. But the problem is the chance of recurrence for oral cancer is very high. So it's inevitable that the oral cancer goes back after the surgery. That's our problem. That's our challenge. So that's the reason why you have to go back to the dentist, to the dental clinic, or in the dental department of our hospital to have your yearly oral examination, dental and oral examination, even head and neck examination, so that we can rule out if you have an oral cancer or not. So it's very important because I always say to my students and I always say to my patients, the only treatment for oral cancer is early detection and prevention.